Good evening, my distinguished audience. How are you all doing? Today is another day, and today I have something beautiful on my table, especially for the beginners, my people who are starting their career in diagnostic medicine. I want to introduce to you biology of diseases, and I'm following the approach of first of all testing your knowledge, how knowledgeable you are in the introduction to biology of diseases. So I'm going to list some questions. If you attend these questions, then I can say that yes, your biology in your O level was not in vain. So I start by asking, how do you know the difference between infection and disease? Remember, the topic said Introduction to Biology of Diseases. So, briefly explain the two terms, that is infection and disease, and state the relationship between the two. Another one is this: can you give example of primary infection and that of secondary infection? The next is explain the term pathogenicity and what parameters are used to measure pathogenicity. And then, what do you call microorganisms that are capable of causing diseases? Are they very difficult questions? I'm sure they are not. Let's go. What terminology do we use to describe attributes of microorganisms that promote pathogenicity? Can you also list and explain some of the factors that assist disease-causing microorganisms to become established in the tissue, multiply, and then cause disease? Define the term microbial toxin. Do we know what toxins are? And when we say microbial toxin, do we understand what they are? What role did Anthony van Leeuwenhoek played in the field of microbiology? What role did he play? Whose discovery is still used today as principle for vaccination? We do hear mothers saying that going for immunization, they want to go and give vaccine to their children. Whose discovery is still used as principle for vaccination? Do we remember Robert Koch? If we do, can you explain his principles of infection? Again, who developed the method of staining bacteria to make them more visible and differentiable under microscope? Explain 4 major natural defense mechanisms that follow portal of entry of hosts against invading microbes. Portal of entry, natural defense mechanism. The skin, the GIT, the respiratory system, the genitourinary tract. What are the defense mechanisms in this portal of entries? Explain with example 3 ways microorganisms interact with one another or with their host. By this, I mean host-parasite relationship. Can you explain 3 ways the parasite and host interact? Give example. What are the microbial flora, or what some other person would call normal flora? What are they? Can you mention any of their importance? If you know, write them out. Let's see. State principle of microscope. You cannot talk about biology of diseases without thinking the microbiology aspect of it, which is our interest today, and the major tool or equipment that help microbiologists to detect disease that are caused by microorganisms is microscope. It's microscope. So identify. Can you identify them? Can you define the principle? Now, if you can identify microscope, can you draw a label microscope? Or let me say, can you list parts of microscope and state their functions? How do we care for microscope in the laboratory? So, if you are able to attempt all these questions, then I would say that you really understood the microbiology aspect of biology of diseases as beginners. Thank you. Go to comment section, attempt some questions there. Just answer anyone you can remember, or you can plan, pull over again, jot them down, attempt them. In the next presentation here, I will know who and who are able to attempt and also measure your level of understanding of basic biology of diseases. See you all next time. Thank you. Make sure you subscribe. Make sure you share. Make sure you visit this page because you will learn a lot. Bye.